Good afternoon, and thanks for joining us. I'm Judy Simpson. As we all know, our bodies change as we age. In general, we see changes in our hearing, hair, or even height. We may also notice changes in our vision or our sleeping patterns. Memory changes occur as well, and for a growing number of aging Americans, Alzheimer's disease and other forms of dementia take hold. So today we're going to talk about aging and memory with Vermont's top expert in the field, and our main focus will be the memory program at the University of Vermont Medical Center. Joining me is Director of the Memory Program, Dr. Bill Pendlebury. Thank you so much for coming in.
You're welcome, Judy.
So what's the history of the Memory Program at the Medical Center?
So the Memory Program was started by my colleague Janice Pizer and myself in 1991. At the time, there were the two of us and a nurse practitioner. We represented the staff. We originally started in the old Brown building on the Medical Center campus that was eventually torn down when the ACC was built. We've moved around the campus now and then, but for the last 15 years we've been at the Fanny Allen campus in the medical office building, and our staff has grown considerably so that we can provide the services that we're trying to provide.
So what can people expect during an evaluation at the Memory Program?
So the initial evaluation is divided into two parts. The first part is about a 2-hour visit that includes a meeting with one of our psychologists and memory testing. The psychologist interviews the patient, and typically we ask that a close friend or relative come as well so that that person can be interviewed. And then the patient goes through a 1-hour memory and cognitive testing session with one of our technicians. Within about 2 weeks, they come back and they see one of the physicians, typically me, and I do what's called the medical part of the evaluation to make sure there isn't a medical condition that might be causing the memory problem. And then I put all of the information together and summarize it for the patient and family, try to make a diagnosis and develop a treatment plan.
I think one of the biggest hurdles, as far as I've personal experience with family members, is just getting them in the door. A lot of times people just don't want to know.
That's true. Often, I would say most often, the person who has the memory problem is not the one that initiates the referral. It's, again, a friend or a close family member. It's surprisingly uncommon or rare that we have trouble getting people in. They're usually willing to come, and most of them are aware that they're coming because someone is worried about their memory, even if they're not. So it's probably 3 or 4 times a year that I have to deal with trying to find a way to shoehorn somebody into the clinic.
When can you tell when it's an issue of just, you know, a memory lapse versus a real problem that's developing?
So the key is the memory problem affecting function? Is the forgetfulness so significant that a person is beginning to lose the ability to do their what are called activities of daily living, take care of themselves, function in the workplace? So an occasional lapse of memory, an occasional not being able to remember somebody's name is not something to be concerned about, although we often see people who we describe as the worried well. And we're very happy to do an evaluation and confirm that this is not Alzheimer's disease, it's not another form of dementia. Now you have a baseline, and if something develops in the future, we'll have that to compare against.
Tell us a little bit about the staff and the roles that they play at the Memory Program.
So we have grown to 10 providers and 4 staff members. We actually have 3 physicians, 3 neuropsychologists. We have 2 social workers. We have 2 nurse practitioners, and that team functions to provide the services that we give to patients and families. We also have 2 people, they're called psychometricians. They do the actual memory and cognitive testing, and we have 2 support staff who run the office. And we're planning to grow even bigger in the next couple of years by adding 1 or 2 additional physician providers and maybe an additional nurse practitioner.
Wow, now you provided us with a couple of key slides that I'd like to take a look at, and you can explain what we're seeing here.
So this slide is showing the demographics of the United States over time, beginning in 1980 and projecting into the future. The white bar represents, or the white bars represent people over the age of 65. And as you can see, starting in 1980, there were about 25 million people over 65, and we're projecting that by the first third of this century, that number will grow to 70 million. The reddish-orange bars represent people over 85, and that cohort is actually now the fastest-growing cohort within the United States population. It went up by a factor of 2.5 over 20 years between 1980 and 2000, and by the first third of this century, it's going to actually go up by another factor of 2.5. The graphics or the verbiage at the bottom of the slide just indicate the percent of people in various age ranges who will develop Alzheimer's disease.
So you're going to be very busy in the years to come.
Particularly in Vermont. Vermont is rapidly aging, and by 2030, it's projected that 1 out of 4 people in Vermont will be over 65, and the number of people with Alzheimer's is going to go up by 41%.
Because age is the number one
risk factor.
Yep.
Yeah.
So what about this next slide we have here?
So this next slide shows the changes that occur in the brain of somebody who develops Alzheimer's disease. The image on the upper left panel is a normal brain. The one on the right, upper right, is an end-stage Alzheimer's patient, and basically what it's demonstrating is atrophy, brain shrinkage.
Right.
And then on the bottom two panels show the microscopic pathology, what I need to see when I look at tissue under the microscope to make the diagnosis of Alzheimer's disease. On the left, a so-called plaque, and on the right, a so-called tangle. So plaques and tangles are the pathologic changes that we look for to confirm by autopsy that a person who had memory loss and dementia in life actually did have Alzheimer's disease.
So what treatments are available that can help with the symptoms of memory loss?
So currently, the treatments that are available are not great. They're not curative. They do not halt the progress of the disease, but they treat the symptoms in the sense that rather than declining in a straight line, most of the time people on these drugs will have a bump up so that they will have an improvement in quality of life, and that will last for a variable amount of time, but eventually the progression goes back to the line that would have occurred without medication. So there are about 4 medications currently available that we use to treat Alzheimer's disease, and I believe that everybody diagnosed with Alzheimer's disease deserves at least a 6-month trial of one of these medications.
And are there other strategies besides medication that can improve memory or at least stabilize some of the symptoms?
So the literature and the studies that have been done well support several strategies: healthy lifestyle, which relates to nutrition and exercise, what we call social integration. We very clearly recognize that people who are isolated and alone are at higher risk for progression of their memory problem. And then the third is what I call intellectual stimulation, doing something on a daily basis that exercises your brain, and it doesn't have to be rocket science or learning a new language. A simple strategy like word search, these paperback books that you can find in the local market or drugstore, that sort of activity for an hour or so a day is going to be very helpful in reducing progression, even in somebody who already has Alzheimer's disease.
For family members, what advice do you give them if they've noticed that their elder is starting to exhibit some of these issues as far as memory loss, and when is it sort of the tipping point to get help?
The sooner the better.
Yeah.
There's very good studies that show that the drugs that we currently have, the 4 that I mentioned earlier, work the best if they're started early on in the course of the disease. And the other issue is for the patient who has the memory problem that may be developing Alzheimer's disease, the earlier we can make that diagnosis, the more likely it is that they can participate in planning and decision-making for the rest of their life. It really for me, it's a difficult situation when somebody is being seen for the first time and they already are losing the ability to recognize relatives and recognize their surroundings, so their ability to participate in decision making about future planning becomes really problematic. So early intervention is good for the patient, good for the family, and makes the treatments more likely to be helpful.
Why do you think people are reluctant to get that help? I mean, if you're sick, you go to a doctor. If you have an injury, you go to a doctor. But for some reason, people are reluctant.
I think there still is a problem with people recognizing normal aging-related memory loss versus memory loss that is representing a disease process. I think people are reluctant to get help and seek a diagnosis because memory is so salient for their life, and to be thought of as losing memory it's not a curse or something to be ashamed of, but there's just this reluctance around memory that I've seen over the 25 years or so that I've been doing this work that delays people from seeking help and attention.
Mm-hmm. What is available for family members? What resources are available? Because oftentimes they're on the front line of dealing with this.
So first and foremost, our clinic tries to provide information and education via our social work team to give caregivers tools to help them manage a memory problem at home. But we also are currently developing specific programs in the memory program that are focused on caregivers, things like powerful tools for caregivers, the Carers program, educational sessions, and we're actually beginning to think about developing an intensive caregiving program at the medical center that'll focus on helping caregivers be better caregivers and make it more likely that they're going to be successful.
Now, you mentioned earlier Vermont's aging population. What do you see as a long-term strategy for dealing with this economic and sort of social burden that's often associated with this?
I think we have to start to think out of the box in terms of how we approach diagnosis and treatment of people around the state who may have Alzheimer's disease. And one of the thoughts one of the ideas that we're developing, it's very rudimentary at this point, is a so-called hub and spoke model, mm-hmm. where we have a center of excellence or maybe two centers of excellence in the state that provide diagnostic and treatment expertise, but then try to facilitate the care, ongoing care of the patient and the family at the local level with teams that have been trained and have been put in place to carry out the treatment program that's been developed at the Center of Excellence. Telemedicine will play a major role in that, and we'd like to try to provide excellent care at a reasonable cost, and we're going to try to be developing that over the next 5 years.
Well, that's critical because Vermont's such a rural state.
Exactly. I mean, there's no reason why everybody with Alzheimer's disease needs to travel to Burlington to get their treatment. And for straightforward cases, many of those people could actually be diagnosed at the local level by a dedicated team of people who want to do this kind of work. Which
actually has a lot of benefits, because for people who have memory loss or Alzheimer's, change is not a great thing.
Exactly.
And so, are there any breakthroughs on the horizon that sort of raise hope for a cure or prevention of Alzheimer's?
Unfortunately, I can't say that there are. The major approach that's currently being taken in the research world around Alzheimer's disease is to try to intervene before the disease actually even starts. So we now know that people who are destined to develop Alzheimer's disease have the pathologic changes in their brain 20 years before they actually develop any clinical symptoms.
And how do you decide that? Is that just...
I'm sorry?
How do you decide that if the person's...
So we now have a toolkit of what are called biomarkers. Mm-hmm. So by doing a very specialized kind of imaging, like with PET scans, high-resolution MRI scans, and with analyzing spinal fluid for certain changes in protein, we can make a pretty accurate prediction that a person is destined to develop Alzheimer's disease. So what's going on worldwide right now are collecting people like this and starting treatment 20 years before they develop any symptoms, to see if eliminating the pathology in the brain before it causes a lot of damage will prevent this disease from occurring. I think that's the direction the research is taking. Having said that, I don't see any breakthroughs on the horizon or in the foreseeable future for people who have established Alzheimer's disease, except to provide really excellent care.
Right. To remind our folks again at home, the Memory Center is part of the Fanny Allen campus in Colchester?
Correct.
Okay. And to find out more information online, you can call the Memory Center or go online. That number is 802-847-1111. Again, 802-847-1111. Thank you so much for joining us today.
My pleasure, Judy. Thank you.
That's our program for today. I'm Judy Simpson. I'll see you again next time on Across the Fence.